You may not see it, you may not hear it, but it's there slowly, silently, and fatally impacting millions of seniors across the world. We often talk about heart disease, diabetes, cancer, but there's another health crisis hiding in plain sight. It's not caused by what we eat or how much we move. It's caused by who we have or don't have around us. We're talking about loneliness. And for older adults, it's not just emotionally painful. It's physically dangerous. In fact, studies now show that loneliness is directly linked to early death. Not just sadness, not just isolation, actual increases in mortality. Research from Harvard, the CDC, and global health agencies has uncovered a chilling truth. Loneliness can be as deadly as smoking 15 cigarettes a day. It raises the risk of dementia by 50%, heart disease by 29%, and stroke by 32%. It weakens the immune system, spikes blood pressure, disrupts sleep, and even alters how genes are expressed in the body. And the worst part? Most seniors don't talk about it. They say, "I'm fine." They stay quiet. But inside, they're suffering emotionally, mentally, and physically. Today, we're going to dive deep into the shocking science behind loneliness and its deadly effects. We'll explore how it rewires the brain, damages the heart, and accelerates aging, and most importantly, what can be done to prevent it. If you're over 60, live alone, or care about someone who does, this video could save a life. Let's break the silence on one of the most dangerous health threats facing seniors today. Loneliness isn't always what people think it is. It's not just being alone, it's feeling alone, even when others are around. It's the aching emptiness that comes from a lack of meaningful connection, the sense that no one truly sees you, hears you, or checks in anymore. For many seniors, loneliness creeps in slowly. Maybe a spouse passed away. Maybe the kids are busy raising their own families. Maybe friends moved away or passed away. Maybe mobility issues or hearing loss make social interaction harder than it used to be. And suddenly, what used to be a full life starts to feel empty. According to the U.S. Surgeon General, over one-third of adults over 45 report feeling lonely, and for those over 65, that number rises even higher. What makes it even more dangerous is that loneliness is often invisible. Seniors may look fine, smile at the grocery store, nod during a phone call, and then return to days filled with silence. But behind closed doors, that isolation has real consequences. Studies show that chronic loneliness increases the risk of depression and anxiety, leads to poor sleep and unhealthy eating habits, can trigger substance misuse or cognitive decline, and significantly reduces motivation to care for oneself. Worse still, society tends to downplay it. We treat loneliness like an emotion, not a health issue. But the truth is, for seniors, it's both. Loneliness is not just sad, it's toxic. And the longer it goes unaddressed, the more damage it does. In the next section, we'll explore how loneliness literally reshapes the brain and why that's so dangerous for aging adults. Loneliness doesn't just weigh on your heart, it rewires your brain. Scientific research has revealed that chronic loneliness changes the way the brain functions. It triggers a heightened state of alertness and stress, similar to being in survival mode. This constant mental strain increases the release of cortisol, the stress hormone, which, when elevated for long periods, damages neurons in the brain. MRI studies show that lonely individuals often have shrinking gray matter in areas of the brain responsible for memory, emotional regulation, and learning. This helps explain why loneliness is now considered a major risk factor for cognitive decline, depression, and dementia in seniors. A long-term study by researchers at the University of Chicago found that socially isolated older adults were up to 64% more likely to develop dementia than those who remain socially engaged. When seniors feel disconnected, they're less likely to engage in stimulating conversations, problem-solving, or memory-building tasks. Over time, this lack of mental engagement can dull cognitive sharpness, increase confusion, and make it harder to recover from emotional setbacks. And the emotional toll? Lonely seniors often experience negative thought loops, feelings of worthlessness, and reduce self-esteem. This can make them withdraw even more, deepening the isolation. The brain thrives on connection, purpose, and stimulation. Without them, it begins to atrophy, just like any unused muscle. And yet, the good news is this: reconnection at any age can restore brain function. New neurons can grow, new connections can form. But first, we have to understand the full impact loneliness has, not just on the mind, but on the body too. Let's look next at how loneliness physically deteriorates the body, from the heart to the immune system. You might not think of loneliness as a medical issue, but your body does. Loneliness doesn't just impact mental health. It takes a measurable physical toll on the body, affecting everything from cardiovascular function to immunity. When you feel lonely, your body enters a state of chronic stress. That activates the fight or flight system and keeps your body in high alert mode, even when there's no actual threat. Over time, this leads to increased heart rate and blood pressure, higher levels of inflammation, weakened immune responses. Studies show that seniors who are socially isolated are at significantly higher risk for heart disease, stroke, type 2 diabetes, and even certain cancers. In one landmark study, researchers found that loneliness was associated with a 29% increase in the risk of heart disease and a 32% increase in the risk of stroke. That's not just emotional pain, that's physiological damage. Loneliness also suppresses the production of infection-fighting white blood cells and increases the body's inflammatory response. Chronic inflammation has been called the silent killer because it's at the root of so many deadly conditions: heart attacks, arthritis, Alzheimer's, and more. And sleep? Forget it. Lonely people are more likely to suffer from insomnia, restless sleep, and sleep fragmentation, which worsens the body's ability to repair and regenerate. Put simply, loneliness ages your cardiovascular system, weakens your defenses against disease, speeds up muscle loss and frailty, and makes recovery from illness much harder. It's time we stop viewing loneliness as just a feeling and start treating it as the serious health hazard it is, one that can be as dangerous as the most well-known killers. Speaking of which, let's look at what researchers discovered when they compared loneliness to smoking and obesity. If someone told you that feeling lonely could be just as dangerous as smoking, would you believe them? As shocking as it sounds, that's exactly what the science says. According to a famous meta-analysis published in Perspectives on Psychological Science, loneliness increases the risk of early death by 26%, and that's comparable to smoking 15 cigarettes a day. Yes, you heard that right. In fact, the impact of chronic loneliness on mortality is greater than obesity, greater than physical inactivity, greater than excessive drinking, and it affects both men and women across all cultures and income levels. Loneliness disrupts the body in ways that compound over time. It's not just about feeling down. It's about slowly eroding your body's ability to cope with stress, fight off disease, maintain a healthy heart rhythm, and even digest food properly. And just like with smoking or obesity, the health effects of loneliness don't always show up right away. They build slowly, invisibly, until one day the damage is undeniable. The kicker? Unlike smoking or obesity, loneliness isn't seen as a medical issue. It doesn't come with warnings, prescriptions, or insurance coverage. That's why it's so dangerous. It hides in the background while people focus on more visible symptoms. But doctors and researchers are now urging the world to take loneliness seriously, especially in aging populations. Some health systems have even started implementing social prescriptions, referrals to community groups, or companionship programs, right alongside medication. Because if we're treating the body but ignoring the soul, we're missing half the problem. Now let's talk about who's most at risk and what signs we need to be looking for. Loneliness can affect anyone, but when it comes to seniors, certain groups are at much higher risk. Let's break it down. 1. Seniors living alone. Older adults who live by themselves, especially after the loss of a spouse, face a significantly higher risk of isolation. Without daily interaction, even small conversations disappear from their routine. 2. The widowed and divorced losing a partner later in life often brings a cascade of change, emotionally, financially, and socially. Friends may drift, routines are disrupted, and a deep sense of disconnection can set in. 3. Those who are retired. While retirement is often seen as a reward, it can also strip away structure, purpose, and social interaction. Colleagues are gone, schedules disappear, and days become harder to fill meaningfully. 4. Seniors with chronic illness or disability health issues can keep seniors at home, limit mobility, or cause embarrassment. Over time, these conditions isolate individuals, especially if they feel like a burden to others. 5. Men in certain cultural groups. Studies show older men are less likely to seek social support than women, making them more vulnerable to hidden loneliness. Cultural stigmas in some communities also discourage open discussion of emotional needs. 6. Caregivers. Ironically, seniors who care for others, like a spouse with dementia, may feel isolated themselves, cut off from outside support, and exhausted by responsibility. If we want to prevent the deadly impact of loneliness, we need to start by identifying who's most at risk and making sure they're seen, heard, and supported. The good news is loneliness is treatable. In the next section, we'll look at what actually works to reverse it. Loneliness may be silent, but it's not irreversible. The human need for connection doesn't fade with age. In fact, seniors often thrive emotionally, physically, and mentally when they feel seen, valued, and included. And the research proves it. So what works? 1. Social prescribing doctors in the UK and some US programs now refer patients to social activities instead of just medication. This could be a local walking group, an art class, or a community garden, something that restores human connection and purpose. 2. Volunteer programs. Seniors who volunteer, even just a few hours a week, report lower rates of depression, better physical health, and longer life expectancy. Helping others brings meaning and builds social bonds. 3. Pet therapy. Animals provide unconditional companionship. Dogs, cats, even visiting therapy animals help reduce stress, lower blood pressure, and provide structure to daily life. 4. Senior centers and faith communities. These places offer routine, conversation, and connection. The key is consistent engagement, not just a one-time visit. 5. Technology training teaching seniors. How to use video calls, email, or social media can help maintain family ties. Connection doesn't have to be physical to be meaningful. 6. Mental health support counseling, especially grief counseling, can be vital. It gives seniors the space to share what they're feeling and feel validated in their experience. Rebuilding social health takes time, but it's worth it. Even small, regular interactions can reverse the harmful effects of isolation. So what can you do today? Call a loved one, drop off a meal, invite someone for a walk. The simplest act of kindness might just add years to someone's life. Loneliness doesn't leave a scar. It doesn't show up on an X-ray. But for seniors, it's one of the most dangerous conditions they'll ever face. We've seen the science. Loneliness reshapes the brain, destroys the immune system, increases the risk of dementia, heart disease, and early death. And does it all quietly. The truth is, we're facing a loneliness epidemic, and it's claiming lives. Not with loud warnings, but with silence, disconnection, and long, empty days. But it doesn't have to be this way. If you're a senior struggling with loneliness, you're not alone. Reach out. Speak up. There are people, programs, and communities waiting to support you. And if you know a senior, call them, visit them, invite them. Sometimes one conversation can change everything. Like this video if it opened your eyes to the impact of loneliness. Subscribe to Elderly and Wise for more life-saving health insights. Share this video with your community, your church, your clinic, anywhere seniors are being overlooked. Because together we can turn the tide on loneliness and help every senior feel valued, connected, and alive.